we started a project for which we got funding from UNICEF and the Embassy of Japan, and they have been helping us to extend the work that the ministry was already doing. The purpose of the project is to ensure that the quality of care that these people receive is the best quality of care that can be provided for them. Through the help from UNICEF and the Japan Embassy, we have been able to get a specific doctor in each of the hospitals that's in charge of quality improvement. They're monitoring the cases that are admitted. They're monitoring the availability of medication, the availability of medical equipment and supplies. We primarily were focusing on women and children, trying to decrease the maternal mortality and the neonatal mortality of the country.
One of the duties that I have is to do accompaniment in these areas, right? I try to visit each area at least once a month, or if they have any pressing issue, I would visit for a second or third time. Now, when it comes to MCH, I have to see if they have the necessary equipment and supplies in the area, if they have the medications that they need. Also, I look at the people too that go there. We have a high indigenous population in this area, and they come mostly every day to get these services because we don't have any private sector here. They depend on us a lot.
At the maternal and child health department at the polyclinic, it's only 3 nurses. Me as the senior public health nurse, and then I have 2 other rural health nurses. And the vaccine uptake is not as good as we would want it to be. People were scared to come out, especially mothers with these young babies for the routine vaccine. They were scared to come out, so we had to be going to them. And sometimes we can't pass to the village that we need to go to. Getting more personnel in the department, it will be better for us. We would be able to go out more, do our supervisory visit, do our home visit with the complicated manners, and I think the services that we offer could be improved.
Yes, I have taken the vaccine. I decided to take it because I discussed it with my mom. She told me to go and get a test because I'm asthmatic, and same with my son. I encourage other mothers to take their babies to get their vaccinations because don't let them get sick all the time.
So the trainings are done based on the needs that are identified within each health area. Other than that, the quality improvement officers have been doing smaller trainings within their hospitals. Through the collaboration with the Japan Embassy and UNICEF, we have been able to reach more people. We have been able to see improvement in the quality of services that's being provided within the health system. We're extremely grateful, and we look forward to continue working with UNICEF and the Japan Embassy as we work towards achieving more of our goals.